Hello everyone, welcome to Dr. Anna's Physiology series. Today we will talk about an important herbal medication, St. John's wort. St. John's wort is it's a herbal antidepressant, over-the-counter herb, which is used for mild to moderate depression. Note the point, not for severe depression, for mild to moderate depression, and also for anxiety. It's also an oral analgesic and a topical antiseptic. Now, the key NCLEX ATI tested points for St. John's wort are first and the most important, serotonin syndrome. Because St. John's wort acts by blocking important neurotransmitters like the dopamine, serotonin. If you take it along with other SSRI, SNRI, antidepressants, or opioids, it can cause serotonin syndrome. Now, how will the question be? The question could be very indirect. For example, the patient is on fluoxetine and has been taking St. John's wort, now presents with agitation, confusion, sweating, hypothermia, or fever. So what is it? It could most likely be serotonin syndrome. So never combine with other SSRI, SNRI, triptans, and tramadol, opioids. Okay. Next important thing is the adverse effects. It can cause dry mouth, constipation, and most importantly, photosensitivity. So avoid direct sun exposure or apply sunblock cream. Again, this is an important point, often tested. And another very important point is it can induce the CYP450 enzyme, and therefore it can reduce the effectiveness of very important drugs such as warfarin, digoxin, certain anti-cancer drugs such as cyclosporin, antiretroviral drugs, and frequently tested, it can reduce the effectiveness of oral contraceptives. So the patient should be asked to take some other contraceptive measure, or the question present could present with the patient has now presented with accidental pregnancy, right? So this is also a very important frequently tested point. Lastly, if the patient is on St. John's wort and the patient has been posted for surgery, the nurse should instruct the patient to stop St. John's wort at least 2 weeks prior to surgery, because it can cause serious drug interactions with anesthetic drugs or even fentanyl or antidepressants which was administered along with it. So that's all regarding St. John's wort. Await my other videos which are related to other CNS herbal drugs. Thank you.